Living with vitiligo is a deeply personal journey that goes far beyond the skin. It often starts with a small white patch, a visible change that can trigger a wave of emotions. Everyday situations like meeting new people or going to the beach can suddenly feel daunting. The emotional impact is often heavier than the physical changes. People may stare or ask questions, leading to frustration and sadness. Many try to conceal their patches, which can be exhausting. But this journey can also reveal inner strength and resilience. Some learn to embrace their unique appearance and educate others. Acceptance isn't always easy, but it can lead to deeper self-understanding and compassion. Support from friends, family, and society is crucial. A kind word or simple acceptance can make a world of difference. The emotional burden lightens when you feel seen for who you are. Behind every patch is a person with hopes and dreams. By fostering compassion, we empower those with vitiligo to live confidently. So what is vitiligo? It's a long-term condition where white patches develop on the skin. This happens when pigment-producing cells, called melanocytes, are destroyed or stop working. These patches can appear anywhere and may grow over time. Vitiligo affects people of all skin types and backgrounds. Importantly, vitiligo is not contagious or dangerous. It's not an infection or cancer, but an autoimmune condition. The immune system mistakenly attacks healthy melanocytes. For some, patches remain small. For others, they spread. The progression is unpredictable and unique to each person. Sometimes patches regain color, but this is rare. The uncertainty can be challenging for those living with it. Understanding vitiligo helps remove fear and stigma. Education fosters empathy and support. Knowing it's an autoimmune issue shifts focus from just the skin to the whole body. True healing begins when we look deeper than the surface. Vitiligo's roots go deeper than the skin. It's a sign of internal imbalance. The immune system, meant to protect, mistakenly attacks pigment cells. This is why topical creams alone often aren't enough. Oxidative stress, an overload of harmful molecules, damages melanocytes and fuels immune attacks. Environmental toxins, emotional stress, poor diet, and sun exposure can all contribute. Nutritional deficiencies in vitamins and minerals like B12, folic acid, copper, zinc, and D are common in vitiligo. Gut health is closely linked to immune balance. If detox systems like the liver and gut are overwhelmed, toxins build up, increasing inflammation. Vitiligo is a complex puzzle involving immunity, nutrition, and detoxification. Addressing only the skin misses the bigger picture. Healing requires a whole-body approach. Looking beyond the surface is key to lasting change. True progress comes from addressing these deeper root causes. Conventional treatments aim to stop the spread of white patches and encourage repigmentation. Topical corticosteroids suppress local immune responses but can thin the skin with long-term use. Phototherapy uses UV light to stimulate pigment and calm the immune system, but requires time and commitment. Other options include calcineurin inhibitors and, in some cases, oral medications or skin grafts. These treatments focus on managing symptoms at the skin level. They rarely address underlying immune imbalances or nutritional deficiencies. Results can be temporary, with vitiligo returning after treatment stops. This gap has led many to explore holistic approaches. True healing may require looking beyond the skin. Enter Natural Immunotherapy, or NIT, a holistic approach to vitiligo. NIT isn't a magic pill. It's about restoring internal balance. Instead of suppressing the immune system, NIT aims to gently rebalance it. The focus shifts from fighting symptoms to supporting the body's natural healing. NIT addresses nutrition, oxidative stress, detoxification, and emotional well-being. It's a personalized approach, unique to each individual. NIT can complement conventional medicine, strengthening your body's foundation. By correcting internal imbalances, you create a healthier environment for healing. This may make other treatments more effective and reduce recurrence. NIT empowers you to take charge of your healing journey. It's about working with your body, not against it. True change starts from within. How does natural immunotherapy work in practice? First, rebalance the immune system with anti-inflammatory foods and targeted supplements. Reduce or eliminate inflammatory foods like processed items and refined sugars. Correct nutritional deficiencies, especially B12, folic acid, zinc, copper, and vitamin D. Blood tests can help identify what you need. Support detoxification by nourishing the liver and gut with foods like broccoli, beetroot, and probiotics. A healthy gut is vital for immune balance. Restore melanocyte function by reducing oxidative stress and providing the right nutrients. Antioxidants from food and supplements protect pigment cells. This process takes time and patience. Progress is gradual, but the goal is to stop vitiligo's progression and encourage natural repigmentation. Healing from the inside out is possible. Consistency and commitment are key. Every small step supports your body's ability to heal. Early intervention with NIT can make a big difference. Newer cases of vitiligo often respond better, as healthy pigment cells may still be present. Acting early can halt progression before it spreads. Even long-standing cases can improve, but require more time and dedication. The goal may shift to stabilizing the condition and supporting any remaining pigment cells. Patience is essential. Healing takes time. Repigmentation is slow and often starts with small dots of color. Celebrate small victories to stay motivated. The journey isn't linear, but consistency pays off. Supporting your body's health is always a powerful step. It's important to be realistic about natural immunotherapy. NIT is not a magic cure or a guarantee for everyone. Vitiligo is complex, and results vary from person to person. Some see significant improvement, others may not. Anyone promising a 100% cure should be met with caution. NIT is a long-term strategy, not a quick fix. It requires lifestyle changes and commitment. NIT should complement, not replace, medical care. Always consult your doctor and consider all options. NIT is an active process. You play the central role. Daily choices about food, stress, and self-care matter. Taking charge of your health is empowering. The journey is about self-discovery and regaining control. It's time to see vitiligo differently. The white patches are signals of deeper imbalances, not just flaws. This perspective shifts us from frustration to empowerment. NIT is built on the body's innate ability to heal. When we support our bodies, amazing changes can happen. Healing from within means creating health, not just masking symptoms. The journey is about overall wellness, not just skin color. Improved energy, mood, and immunity are often side effects. Embracing this view transforms your relationship with your body. Treat yourself with compassion and respect. The process is about becoming healthier and more resilient. True healing nourishes body, mind, and spirit. If you're living with vitiligo, you're not alone. Millions share this journey, and there is hope. Our understanding of vitiligo is growing, and you have the power to influence your health. Be kind to yourself and seek support when needed. Your worth is not defined by your appearance. Embrace your uniqueness. It's empowering. Learn about your condition and become an active partner in your care. Knowledge transforms fear into action. Trust your intuition and take small steps forward. Never lose hope. The body's capacity for healing is remarkable. Whether you repigment or simply halt progression, every step is a victory. Your journey can lead to a healthier, more vibrant life. Embrace it with courage, patience, and belief in your body's ability to heal. You are more than your skin. You are resilient and strong.